Well, International Overdose Awareness Day is on Sunday, meant to bring a global community together to take action on the devastating and tragic impact of the toxic drug and overdose crisis. For more on this, let's bring in Dr. Matthew Tenenbaum, the Associate Medical Officer of Health at Wellington Dufferin Guelph Public Health. Dr. Tenenbaum, first I want to ask you, what are healthcare professionals seeing in relation to overdoses in your area?
Certainly, overdoses are still very much a part of our experience. Drug poisonings are still very much something we're seeing in our community. We've been dealing with them as a community for, a decade or so now as a major issue. We have seen some perhaps decreasing numbers over the past couple of years in terms of number of people dying as a consequence, number of people going to the emergency department or hospital as a consequence, but it's still a very significant issue in our community, and it affects people in the hospital, in the emergency room, but also healthcare providers in the community who try to help people who are experiencing addiction to or dependence on some of these substances.
Yeah, there's a lot of people involved, so it makes sense that it would extend to the healthcare professionals as well. Supervised consumption sites were closed earlier this year. Has that had an impact on the number of overdoses?
So right now, we know that we're one of the communities that's transitioning from having a supervised consumption site to one of the new Heart Hub models, which comes with some investment from the provincial government. As this change has been happening, of course, it does change a lot of how people access services in our community. We've been trying to keep an eye on the data to see if there's anything we're seeing that suggests there's something we need to act on differently as a community. We know we're hearing a lot of people feeling like they are connected differently to the health system as the changes to services occur, but we're not seeing any large-scale change to the number of drug poisonings or things like that in our community. It's still something we're monitoring closely, but we're still in a similar context as we were earlier this year.
Okay. When it comes to a toxic supply in the community, how do health units discover this and track it?
So a lot of it comes from data we get from our community partners. We in public health are responsible for overseeing, from a data perspective, what's going on in our community, and really developing a good understanding about what people are experiencing when they're going through a drug poisoning event. And we have a system set up with partners where they can submit information to us when people experience a poisoning, or they hear about changes to supply from particular dealers or vendors. We also are linked into data from the province and police seizures of drugs, things like that, inform our understanding, as well as where we can test drugs as a community. We do see the results from those. And what we see is that over recent years in particular, there has been significant issue with the drug supply becoming more toxic, less safe. A lot of issues where these substances are contaminated by different kinds of substances that are mixed in. That can make it more challenging when someone is experiencing an overdose or a drug poisoning to reverse it using our usual methods. The things we do focus a lot on opioids, but if those opioids are mixed in with other substances, people can experience other symptoms that are more challenging to address.
Okay, that makes a lot of sense. A couple overdose awareness community events happened this afternoon, one in Orangeville and one in Guelph. How important are these events?
I think they are really important. I think that for people who use substances and who are touched by this issue in our community, a lot of these people experience stigma, a lot of these people experience isolation. In some cases, they don't have family or friends they can rely on as a consequence of what they're going through. I know that events like this are really important to building community among people, helping people feel seen and heard by their peers, helping health partners like us have ways to connect with people who are experiencing these kinds of things. I know from our perspective as well, as a health unit, as well as the perspective of many of our partners, events like these are really important because it helps us to hear the lived experiences and the stories of people who are living this issue day in, day out. It helps us ground our work, ground our understanding. Not all of us who participate in the response deal with this on a personal level, but it is a way for us to stay connected, to understand it, so that we can orient ourselves in the most helpful way possible.
And kind of speaking of those people, if someone knows someone who uses or someone who uses themselves, what can they do to help keep them safe?
The most important things, if you are using, is to not use alone and to try and go slow, in particular if the substance you're using is from a new source or you're not sure what's in it. As I said before, we are dealing in recent years with significantly worsening contamination of the drug supply with new substances that can lead to unpredictable kinds of overdoses or drug poisonings. So really using with someone around you who can monitor you in case you are overdosing and therefore respond is important. We and other partners are involved in providing naloxone in the community, which is a drug that can be administered to someone who's experiencing an overdose to help reverse that overdose and keep that overdose from killing them. So that is something we really want to make sure is available to anyone who might be using or anyone who is with people who might be using, because that can save lives.
All very important information to know. Well, that's about all the time we have. Thank you for joining me, Dr. Matthew Tenenbaum. That's Dr. Matthew Tenenbaum, the Associate Medical Officer of Health at Wellington Dufferin Guelph Public Health.
Thank you very much.